My name is Tonja Myles. I'm a certified peer support specialist. I'm a veteran. I'm a licensed ordained minister. I have been in recovery for over 32 years. I have a mental health diagnosis of PTSD, anxiety, and depression. So that's why I'm so adamant and passionate about doing work in my community when it comes to mental health and substance use disorder. The importance of vaccinations resonate with me when I was a little girl. I lived not too far from the public health unit. And so I just remember those times going to the health unit and, getting those shots and not understanding, but knew that they was necessary. For me, when I decide to get vaccinated, it is a lot because I finally got on a great regimen of mental health medication that works for my beautiful brain. And so now having something else come into the mix, I'm always cautious of what's the side effects. Being a African American woman, I also thought about the tradition and the trauma and the trust that comes with that, from years past. And, is this something that's just gonna be an experiment, or is this something that is really necessary? And then also my faith. When COVID hit, I was terrified and concerned and was like, are you kidding me right now? Is this some end time stuff happening? Is this chemical warfare? And just like everybody else, confused, scared, concerned. And then when you start hearing about people dying, it changed the game. There were so many decisions and so much noise and so many things that came into play that for anyone, you would be confused. I just really had to trust the people that worked in the field, like my heart doctor, my primary care doctor, friends and family who knew more than I did to make that decision on whether or not I was gonna take that vaccination. And I'm glad I did. Taking the vaccine and being on mental health medication, it worked out fine. Probably for the first couple of weeks, I was still concerned because I was waiting to see if my brain reacted differently, and it did not. So I was grateful. We know God to be a healer, which He is, but He also created the beautiful brains of doctors and nurses and people in the healthcare profession. And so from a faith-based perspective, I am challenging people to think different. Do your homework, do the research, talk to people that you know that are credible healthcare providers and ask them, and you make the decision that's best for you and your family.